Today we are performing a PDO thread lift procedure, and we are targeting this patient's jawline. As you can see, she's a pretty young patient, doesn't need a whole lot in terms of a lift, but she's looking for a little bit more of like a chiseled jawline. And she does have a little bit of laxity in the tissue of her lower face, and so we decided to do a PDO thread lift procedure. As you can see here, we used a lidocaine injection to numb our entry point. And now we are taking lidocaine with a cannula, creating the tunnel in which our thread is going to go and numbing that space. Now we use this technique at the AAFE for a couple of different reasons. It provides ultimate comfort for our patients. So we're numbing that entire tract. So when we go and place the thread, they feel nice and comfortable. But it also allows us the opportunity to establish the tract in which we're going to place our thread. It makes the placement of your thread much easier because we've already created that tunnel. So you can see now I have taken my PDO thread and I am placing it into the subdermal plane, as that is the appropriate plane for threads. You can see I'm sort of using a curtain over curtain rod technique where I'm more so pinching the tissue up and sliding it over the needle. Once you get into the proper plane, it's really easy to stay there when you're using proper technique. I've just removed our first thread and I'm going to place our second thread. I decided to use 2 threads here because she's really looking to pull that skin back pretty tight. And so just a second thread is going to help give her that extra lift. So I'm now taking my second thread and following that same exact track that we've already gone through, just for a little extra support. So again, you can see we're using that curtain over curtain rod technique, sliding through the subdermal plane to our terminal end point, and then we're going to pull the thread out. What happens when we remove the thread is that it engages into the tissue. There are barbs on the PDO thread that then essentially tack the tissue onto the thread, and that's where we get our lift. As the threads dissolve over time, they stimulate collagen and elastin, which can help further increase tightening of the skin, lift in the tissue, and overall just improve the overall health of the skin. So you can see there's a nice lift that we have on that thread, and we're going to clip the end. Once we clip the end of the thread, it tucks right inside the tissue, so you won't actually see anything on the outside of the face. Cleaning the face off really nice and good so that I always like to use alcohol after the procedure to make sure our entry point is nice and clean. And then we're going to cover the area with a Band-Aid. Typically, I ask the patients to leave Band-Aids on until the evening. At that point, they can take the Band-Aids off, wash their face gently, and just resume their normal routine. We do ask that they avoid the use of rotating facial brushes like a Clarisonic, for example. We don't want to displace these threads and potentially disrupt them, and so we ask them to avoid that for the first several weeks. But she is able to wash her face gently and resume her normal topical products that she uses on her face. The patient will be a little bit sore for the next several days. The face should feel nice and tight, and it might be a little bit difficult for her to sleep on the sides of her face given the soreness that she's experiencing. So I typically advise them to sleep on their back for the first couple of nights, just so that they're not in any more discomfort than they need to be. And you can see the first side of the face is already done. Given that we're only doing, one vector here, it's a pretty easy procedure to just place these 2 threads relatively quickly. So again, we're going to do the same thing on this side. I'm using lidocaine to numb the point in which I will enter. And this is my pilot needle, so I'm using this to create my entry point. As you can see, there's an X along her jawline, and what I've marked is her antegonial notch, which is the notch in the mandible in which the facial artery travels. And it's essential that we avoid that notch for the reason that we don't want to accidentally affect the facial artery or hit the facial artery. And so I always mark that off on my patients just so I have a visual of where I don't want to be going. You can see here we're well above the jawline. We're about maybe 2 centimeters above the jawline. And this is where I felt like I was going to get the best pull for this particular patient. Treatment planning, of course, is going to be completely individualized, as it is for any facial aesthetics procedure, because everybody has different anatomy and they have different goals. And so it really takes an individualized treatment plan for each patient. And this was where I felt like I got the best pull on her. So I've just numbed my track, and now I'm coming back with my PDO threads, and you can see I'm just again using that curtain over curtain rod technique, sort of sliding through that subdermal plane until I reach my end point, at which time I will remove my thread and place my second thread. It's really important that the patients avoid high impact activity for the next 2 to 4 weeks. Any jostling can work against the lift. First of all, it does increase the risk for breaking of the threads, but it also can work against the lift. So if we establish a nice tight lift in the face and then they return to CrossFit the following day and they're jump roping and doing a whole lot of high impact activity, they're not going to get as good of a lift over time as they would if they were careful with the threads. And so we say no high impact activity for 2 to 4 weeks. They're able to walk, use the elliptical, ride a bike, swim, so on, but nothing where there's going to be a whole lot of jostling. So our second thread is now complete. And we're going to just smooth the tissue, making sure all the barbs have engaged into the tissue so that there's no dimpling of the skin. And then once we're done there, we will go ahead and clip those threads, place the Band-Aids, and the patient will be all set to go. She can certainly ice if necessary and take Tylenol if she's having any discomfort this evening once that lidocaine starts to wear off. Of course, we always ask them to avoid any anti-inflammatories, as this will increase the risk of bruising post-procedure. Thank you so much for watching. We hope to see you in a PDO thread lifting course soon at the AAFE.